Welcome to the deep dive. If you're looking to really get your head around healthcare quality improvement, cut through the noise and understand what actually works without getting swamped by jargon, well, you're in the right place.
Absolutely. Today, we're zeroing in on some core tools, the things that help healthcare organizations really make improvements happen.
And specifically, we're talking about key performance indicators, KPIs.
Key result areas, KRAs.
And how they fit into the Balanced Scorecard, the BSC. It's all about how these connect, right?
Exactly. How they work together to measure progress, define who's responsible for what, and crucially, give that big picture view.
Okay. And to really dig into this, we've looked at a bunch of solid sources. We've got insights from JCI, that's Joint Commission International.
And NABH, the National Accreditation Board for Hospitals and Healthcare Providers here in India.
Plus the international perspective from ISQA, the International Society for Quality in Healthcare.
And we also drew quite a bit from a specific source, the QI Playbook Episode 16, which focused directly on KPIs, KRAs, and the Balanced Scorecard in quality improvement. Really practical stuff.
All right, along with some other useful materials we found. So the mission today.
It's really to understand how these tools give healthcare teams, well, clarity first. Clarity on what they aim for.
And then the direction on how to get there.
Yes, direction for effective strategies. And finally, accountability, making sure things actually get done and deliver results for patients and the organization.
Okay, great. Let's jump straight into KPIs then. Key performance indicators. We hear that term constantly.
We do.
But what makes a KPI really key? What makes it effective?
Well, a good KPI, a truly key one, acts like a compass. It's a measurable value, something tangible.
Something you can actually track.
Exactly. It shows you how well you're doing on a very specific objective. Think about a hospital trying to cut down infections.
Right.
A KPI, like, say, the number of central line infections per 1,000 patient days. That gives them a clear, trackable number. They can see if their efforts are working.
Got it. Something concrete. Now, the QI playbook really hammered home the idea of making KPIs SMART, that acronym.
Ah, yes.
Yeah.
SMART. Specific, measurable, achievable, relevant, and time-bound.
It sounds simple, but it's crucial, isn't it?
It really is. It's more than just, a checklist. It's a filter. If your potential KPI doesn't meet all those criteria,
It's probably not going to be that useful.
probably not as effective, no. Like saying you want to improve patient experience, that's a great goal, but it's not SMART.
Too vague.
Right. But if you say, increase the percentage of patients rating their experiences excellent by 10% in the next 6 months,
Yeah.
now that's SMART. It's specific, you can measure it, it seems achievable, it's relevant, and it has a deadline.
So a potential pitfall is maybe measuring something easy but not very important, like a number of meetings held.
That's a classic example. You can track meeting attendance perfectly. But are those meetings actually leading to fewer medication errors or shorter patient stays?
Probably not directly.
Exactly. So while measurable, it's not key to the core goals. The best KPIs are really focused on what truly matters for the organization's strategic success. Patient outcomes, efficiency, safety, things like that.
Okay, that clarifies KPIs. They measure progress on specific goals. Now, what about KRAs? Key result areas. How do they fit in? How are they different?
Think of KRAs as broader categories. They define the main areas of responsibility for a role or a team.
So less about the specific measurement, more about the job's focus.
Precisely. They outline where someone needs to deliver results. KPIs then measure how well they're doing within those defined areas. KRAs define the scope of accountability.
The podcast used a nurse manager as an example. What would KRAs look like for them?
Right. For a nurse manager, typical KRAs might be things like staff management and development. That's a big one.
Makes sense.
Then maybe patient care quality, overseeing the actual care given. And definitely compliance and safety, making sure all the rules and protocols are followed. Those are the big buckets.
Okay, those are pretty broad buckets like patient care quality. So the KPIs come in to make that measurable.
Exactly. Within that KRA, patient care quality, you'd slot in specific KPIs. For instance, you might track patient fall rates on the unit,
Okay.
or maybe medication error rates, or patient satisfaction scores related to nursing care. These KPIs give you the hard data on performance within that key result area.
Let's go back to that emergency department example. If the ED manager has a KRA for, say, operational efficiency.
Operational efficiency or efficient patient flow, something like that.
Right. What KPIs would fall under that?
Well, under efficient patient flow, you definitely want KPIs like average wait time, door-to-doctor time.
Classic one.
Yep. Also, Maybe patient throughput or total length of stay in the ED, especially for patients who get admitted.
Yeah.
Perhaps the percentage of patients seen and discharged within a target time,
Yeah.
like 4 hours, those directly measure efficiency.
Okay, I think I'm getting the relationship. KPIs measure the what, the progress. KRAs define the where or who, the areas of responsibility.
About it.
So now, the third piece, the balanced scorecard. How does this tie KPIs and KRAs together for the whole organization? Sounds strategic.
It is very strategic. The Balanced Scorecard, or BSC, is a framework. It helps organizations look at their performance from, well, multiple perspectives, not just the financial one.
Which is vital in healthcare, right? It can't just be about money.
Absolutely not. The BSC insists that long-term success isn't just profit. It depends on balancing financial health with other critical areas.
And what are those other areas, those perspectives?
There are typically 4 key perspectives in the classic BSC model. First, financial. Obviously, are we sustainable, using resources well? Second, customer, which in healthcare usually means the patient. Are we meeting their needs? Are they satisfied?
Crucial.
Third, internal processes. How well are we running things internally? Are our core processes, like delivering care, efficient? Are they high quality?
Right, the operations side.
And fourth, learning and growth. This looks at the organization's ability to, change, improve, innovate. Do we have the right skills, the right culture, the right technology to keep getting better?
Financial, customer, internal processes, learning, and growth.
Right.
Okay. So it forces a broader view.
It really does. It stops you from focusing only on, say, cutting costs and ignoring the potential impact on patient satisfaction or staff burnout. It pushes for balance.
And how do the KPIs and KRAs plug into this?
They are absolutely essential to making the BSC work. You basically map it out. For each of the 4 perspectives, the organization defines its strategic objectives.
Okay.
Then you identify which KRAs, which areas of responsibility across different teams or roles are most critical for achieving those objectives.
Right.
And then you select the specific KPIs that will measure progress within those KRAs, telling you if you're actually hitting your strategic objectives across all 4 perspectives. It connects day-to-day metrics to the big picture strategy.
That example from the QI playbook guest about the hospital network reducing heart failure readmissions, that really illustrated this, didn't it?
It was a great example. Their big strategic goal was reducing those readmissions.
Okay.
So using the BSC lens, under the customer perspective, they likely aim to improve patient satisfaction with discharge planning. Under internal processes, a key objective would be improving the effectiveness of patient education before discharge and the follow-up support afterwards.
Right.
And maybe under learning and growth, they focused on ensuring staff had the latest training on heart failure protocols.
And then they used KRAs and KPIs within that structure.
Exactly. So for the cardiac team, working on that internal process of education, their KRA might be effective patient education.
And the KPI.
A KPI could be percentage of heart failure patients receiving comprehensive discharge education, documented in the chart.
Got it.
For the nursing team involved in follow-up, maybe under internal processes again, the KRA is proactive post-discharge support.
Okay.
And a KPI could be the number or percentage of patients receiving a follow-up call within 48 or 72 hours.
And you could link a customer KPI too, like satisfaction scores.
Absolutely. You'd track patient satisfaction survey results, specifically asking about the discharge instructions and follow-up. That closes the loop back to the customer perspective.
So using the BSC ensured they looked at the whole system, the education, the follow-up, and the patient's view, not just one piece.
Precisely. It prevents tunnel vision. It helps understand how different activities connect and contribute to the overall goal. It gives a much clearer picture of what's working and what still needs attention.
You mentioned JCI and NABH earlier. It sounds like these tools, KPIs, KRAs, BSC, are fundamental to the kind of quality systems these accreditation bodies look for.
They absolutely are. Accreditation standards, whether from JCI internationally or NABH in India, heavily emphasize structured, data-driven quality improvement.
Right.
KPIs are the data. KRAs provide the structure for accountability. And the BSC provides a strategic framework to ensure the efforts are balanced and aligned with overall goals. JCI, for example, often talks about how their process improves teamwork.
Which you need to make this work.
Exactly. You need that coordination and communication to define meaningful KRAs and track the right KPIs across departments.
And NABH being part of the Quality Council of India just reinforces how central this systematic approach is nationally.
It does. It shows a commitment to building these quality structures into the healthcare system.
And ISQA promoting this globally.
Yes. ISQA's work highlights that this isn't just a local trend. Using performance indicators, defining responsibilities clearly, taking a balanced strategic view, these are recognized worldwide as best practices for improving healthcare quality and safety.
Okay, so bringing it all together, if someone listening wants to apply this or maybe refine how they're already using these concepts, what are the main actionable points? What did the QI playbook emphasize?
They distilled it down nicely. 3 main takeaways, really. First, align your KPIs directly with your core strategic objectives.
Don't just measure for measurement's sake.
Right. If patient safety is your top priority, focus your KPIs laser-like on things like infection rates, medication errors, patient falls, near misses. Marry what truly drives progress towards that strategic goal.
Okay, alignment first. What's number 2?
Second, clearly define KRAs for the relevant roles. Who is responsible for what? This clarity is key.
Drives accountability.
It does. Once people know their key result areas, they can focus on the specific KPIs that show how they're performing in those critical functions. It brings focus and ownership.
Makes sense. And the third takeaway?
Third, use a balanced scorecard approach. Don't fall into the trap of only looking at finances or only at operational numbers.
Take that holistic view.
Yes. Use those 4 perspectives: financial, customer, internal processes, learning, and growth to get a complete picture. It helps ensure you're not improving one area at the expense of another and leads to more sustainable, well-rounded improvement.
So it really comes down to this. KPIs, KRAs, the balanced scorecard, they aren't just management jargon. They're practical tools.
Very practical. They provide a connected system, a structure.
To move from just wanting better quality to actually measuring it, managing it, and achieving it.
Precisely. They give you clarity on where you're going, a roadmap for how to get there, and the accountability to make sure you stay on track. Whether it's reducing readmissions, improving patient satisfaction, making operations more efficient, these tools provide the framework.
Great stuff. So for everyone listening, here's something to think about, maybe mull over after this deep dive. Consider a healthcare organization you know well, or maybe even where you work. What would you say are 1 or 2 of its most important strategic goals right now? And thinking about one of those goals, what could be a key result area, KRA, for a specific team that directly contributes to it? And then take it one step further. What's one specific measurable KPI they could use within that KRA to really track their progress? Just thinking through that change strategy to KRA to KPI can really solidify how these powerful tools connect in the real world.